Well, good morning once again. My name is Jennifer Hackman. I'm the Economic Development Manager for the City of Pullman. And joining me today is Dan Records, who is a City of Pullman Council member for Ward 2. Dan's been a council member for about 2.5 years. He is also the ADA and Senior Civil Rights Compliance Coordinator at WSU, Vice President for Inland Oasis, which is an LGBTQ nonprofit, and a graduate of WSU with a BA in Political Science and the University of Idaho with a Juris Doctor. Dan, a few weeks back, brought the idea of surveying our area to get a sense for consumer confidence as we look at reopening in Whitman County. And we felt that this would be helpful to guide our businesses and our public entities so that they knew kind of where people are with health and safety guidelines. So Dan created this survey, and I helped a little bit, but most of this really goes to Dan's vision to bring this information and to understand our community a little better. We recognize that this is a moving target as constant change occurs and the situation in our environment changes. But we wanted to give our business and nonprofit community some kind of insight into really where the community is. So with that, I'm going to hand this over to Dan, and he can start to take you through some of the data. We're going to start with kind of the introductions and demographics of the survey. We started the survey on May 12th and ended it May 25th. And received 2,359 completed responses. And those were from around the region, not just in Pullman, but you'll see some of that data. And then Dan's going to talk about some of the industry-specific responses. We'll go through individual responses to specific health and safety measures. And then we'll wrap up with some overall takeaways. So Dan, take it away.
All right, thanks, Jennifer. So the first section that we're going to go through is just kind of talking about who was it that took the survey. And so we had a number of demographics questions in there, and we just wanted to try to capture. And one of the things that I wanted to make sure that we did was if there are specific demographic breakdowns that any of our nonprofits or business leaders want to explore in more detail, that would be the next phase of kind of the data rollout is I can do some breakouts by specific demographic categories if there's interest in that. During the initial kind of preliminary assessment, when I was just looking at the data and talking with Jen about thinking about how we could present the data, one of the things I looked at was how do we create that rollout? And when I looked at the question of, and I'll jump to the next slide. When you look at the question of children under 12 in the home, I just ran through some numbers there, and that one in particular didn't seem like there were any stark contrasts, but we haven't yet run through any of the other categories. So if there's interest in there, when we kind of get to the end of this section, we can kind of open it up and see if anybody has any thoughts on specific demographic breakdowns. So, Dan, yeah.
I do want to put this in context for folks if you're curious about this. I did, comparing some of the demographics for who took the survey to who is usually in Pullman, just to share. Normally the population in Pullman is 32% ages 20 to 24. And about 10% ages 25 to 29. So you'll see that this doesn't track exactly to how the American Community Survey pulls demographic data, but we feel that this is probably more reflective of, if you will, summertime population in Whitman County and in Pullman. So, and in Whitman County, we normally do have 51% male, 49% female, just to give you a sense of how that compares.
Yeah, thanks, Jennifer. Yeah, so if you look at the age pie chart here, we do have a more even distribution in the respondents for this survey. So I think you're right that that is probably closer to our summertime population. And that has probably a lot to do with the fact that so much of our student population has left, and or they're not as engaged online with Pullman right now. And I don't really have any strong sense of why we have kind of the gender breakdown that we do. One of the things that I found interesting about the gender responses is that I did include the gender X category, as that's now in Washington state law, there is the option for folks to choose gender X on their driver's license or birth certificates. And so we did have 1.2% of respondents answered gender X. That equates to about 20 or so individual responses. And out of that, about 5 of them, I think, were not in the transgender or non-binary category. They were more in the not understanding the question based on how they filled out that question. But that is an indicator that I think we'll start to see more in surveys, is including those additional gender categories. And of course, the free version of Qualtrics had this question already in there, so it had male and female, even though that corresponds to sex and not gender. We understood that. It's just I couldn't figure out a way to change that from the template question. One of the important questions I wanted to make sure we had in there is understanding from the respondents what their connection was to Pullman. So if you see, we have about 75% of respondents answered that they live in Pullman year-round. Only about 2.4% said they live here part of the year. And then the rest, the remaining 22%, either live outside but work here, they shop or recreate here, or they're a student here but live outside of the city of Pullman. So that can kind of give you a sense of if your business caters to more people that are full-time residents, or if they cater to people who are just coming through town even on a daily basis as they come to work. The other 2 categories that we had were trying to get a window into who might be in a CDC classified high-risk category under this pandemic. So I used the language directly from the CDC to determine, allow people to identify if they are in any of those specific high-risk categories. And so you can see that a little under 70% indicated that they are not in a high-risk category, with the remaining 30% in high-risk categories. And that one, I wanted to make sure we put that in there so we could understand, and I will be doing a demographic breakdown on this question to see if there is a significant disparity in responses between people who are in high-risk or not high-risk categories in how they feel comfortable. Because I think that's on a lot of people's minds, is how comfortable they're going to be re-entering into to businesses and re-entering into the economy in a physical space. That may be something that weighs on a lot of people's minds. And I saw that in the narrative responses, as well as not only people who themselves identify as high-risk categories, but they have either family members or household members or roommates that are in high-risk categories, and that seems to be impacting how they feel about health and safety measures as well. Like Jen said, we had 2,359 completed responses. We did have over 3,000 total responses, but there was about 600 or 700 people that either only responded partially, or they got most of the way through the survey, but they didn't get to the actual submit button. So there is additional information in there. I will be taking a look at that to see if there's any significant differences in how those shake out versus this data set. But these are about 2,400 completed responses. So I was rather impressed with that for kind of the quick rollout that we had, and just the interest that I think the community has in being able to provide feedback and have a voice in this. That was one of the main reasons why I wanted to do this, was not only to get all of you some good data to be able to make some decisions on how to reopen or how to communicate how you're reopening to your consumer base, but also I really think it's important to give people something that they can do and something that they can participate in. because it's so many of us have been working from home or stuck at home or have lost jobs, and just sitting at home and isolating is just the psychological impact that has. I think it's important to keep re-engaging with people and get them some sense that they are participating in a solution to this. So those are some of the main takeaways, main reasons why we wanted to do this survey in the first place. But I think now would be a good time if people have any questions about the demographics, or if there's any kind of specific demographic breakdowns that people are interested in seeing, I'd like to talk about that.
Sure. So Dan, Art Swanek has a question. Art, go ahead.
Thanks. Hey, Dan, I was wondering about the 16.3% with underlying health condition.
Yeah.
The other two categories there are pretty much fixed in that they're vulnerable, but the underlying health, is there any data as to whether those people are somebody's just gone through surgery and recovering, or somebody with a long-term condition that would be constantly part of that demographic?
So there was, as part of that, there is a, and I don't think it's part of that question, but in some of the narrative responses, people did offer more detail about that. So we probably don't have specific responses for all of the 16.3% there, but that could be something I look at, looking at those narrative responses and trying to match that up of is it a temporary situation or is it a more permanent situation. I think there's potential there that we can narrow that down a little bit and break it out in a further analysis. So that's a good point.
Thank you.
Thanks, Art. I don't see anyone else with themselves unmuted at this time. I do want to point out that I think personally 2,400 responses is really incredible, considering that, in Whitman County, we have about 50,000 people, and in Pullman, about 37,000 people. And that's not during the summertime, that's during the fall and winter. So that's an amazing response. However, we should acknowledge that this was not a randomized study. So we got the word out as much as we could, and people who were tuned in to where we were able to get the word out, we're definitely getting on and taking the survey.
One additional thing before I move on, I thought it was also interesting. Qualtrics, the Qualtrics platform, Jennifer and I participated in kind of a long, lengthy discussion with the Qualtrics representative. We utilized the free platform that they put out. There's a free version of Qualtrics. It does have some limitations, but that's what we were able to utilize to create the survey. And I think that's an option that's available to they just opened it up generally during the pandemic to a lot of businesses to have a free platform. So there are some options there for if your organization or your business is interested in using a survey platform. They do have some template surveys that are specifically geared towards COVID response, including internal employee surveys, customer surveys, and some other things too. So if you're interested in that, I'd be interested to talk with you or willing to talk with you about how to utilize that, how to get in touch with those resources. And the fact that we had 15% of our survey respondents were over the age of 63. It is something that I think Qualtrics makes it a very user-friendly experience. It's a very mobile-friendly platform. It's easy for people to take these types of surveys. So with that, I'd like to get into some of the next sections. So the next section is really talking about focus on the type of business. This question was really about just getting an overall sense of what is in people's minds when they're thinking about going into a business. And so you can see a lot of where people's focus is on what specifically is the business going to be doing with health and safety measures within the establishment. So almost 70%. Also, prior interactions with the business, the confidence of knowing the business owner or the employees having a personal connection, I think, is a pretty strong indicator of how comfortable people are going to feel. And then as we start to taper off towards the more general issues with health and safety measures required of customers or healthy safety measures provided to customers, Those are still important to a lot of people, but it looks like what a lot of people are focused on with this question is, what is the business itself doing, as opposed to what are they asking customers to do? And then when we get into the widespread testing, contact tracing down at about 20%, that's more of the, I think the category where people are thinking, what is the situation on a national level or state level or regional level, and how comfortable I'm going to feel. And then the last category is the folks that are more comfortable, just they don't need anything additional, they just want to get back to it and get going again. And they're not as concerned necessarily about specific health and safety measures, they just are itching to get back to it. So I think there's a clear majority that has those specific health and safety measures on their minds, and there is still a minority of people that either don't think it's necessary or they're just less concerned about it. And so as we're thinking about how we're going to frame our communication strategy, frame what decisions we're going to be making, I think it's important to keep in mind, we're going to have to answer that for the majority of respondents here, but also keep in mind that there is a minority of respondents that are also ready to get going, regardless of what we do with the health and safety measures. The next breakdown, there's going to be several slides here, so I'm going to spend a little bit of time on each one, so you get a chance to kind of absorb it. But these are the questions where we were looking at specific industry types. And when you're looking at these pie charts, the blue section on the right side, the upper right side, wrapping around to the bottom left, is people that say they're willing to start right away in this type of business. The orange question, which continues going clockwise around the pie chart, is folks that want to wait at least 1 month before they'll feel comfortable going into that type of business. The gray section, going clockwise again, is people that want to wait 3 months or more. And then the final section, the yellow at the top of the clockwise rotation, is people that aren't going to feel comfortable until kind of the national or regional environment for the pandemic is calmed down significantly. And that's with significant contact tracing, a significant reduction in positive cases. So even in Whitman County, where we haven't seen a lot of positive cases, there's still you can see here for dine-in restaurants, 13.4% of folks are saying they won't feel comfortable. But a majority of folks are feeling more comfortable with that right now. So 44% are ready to start dine-in restaurants right away. I think you'll see when we get into the health and safety measures, this has to be taken in the context of that combined question when you see 70% of respondents are concerned about the specific health and safety measures. So 44% are ready to start in dine-in restaurants right away. But that probably also means they're going to want to see some of those specific health and safety measures before they enter a restaurant. So next category is boutiques, shops, and retail. Significantly more people there, I think, are ready to get back to that. So 60% right away, another 22% within a month. And keep in mind that this survey has been taken over the last 3 weeks. So as we move forward, this is, like Jennifer said, an ever-changing target. As we learn more about the pandemic and as we start to see things taper off more, I think these attitudes will shift towards the positive more and more if we see those trends continue to go in that downward trend. Grocery, I think, is that's an easy one because grocery stores have been open this whole time. So there's probably a lot more people have been used to going to grocery stores, so they're a lot more confident in that right now. There were quite a few of the narrative responses that talked about grocery stores, and I think, Jennifer and I talked about that a little bit. There were some specific concerns raised about specific stores, or probably I would say about 25 specific comments calling out not seeing employees wearing masks in the grocery stores or not seeing customers wearing masks, and concerns about that in the grocery stores. So I think one of the takeaways that I take from that and seeing those narrative comments and how people are responding to that is that when you're reopening or when you have a business that's been open this whole time, customers are going to be touchy about what they see happening on the ground. What is your implementation of health and safety guidelines and measures? So it's not just what are your listed practices, but also if I walk into a restaurant or if I walk into a grocery store and I see a whole bunch of people not wearing masks, that's going to make me stop and think, do I want to continue going into the store? Or do I want to go start finding another store to go to in the meantime that's going to have some of those things that are more visible, that's going to increase my confidence in my safety in that establishment. So I think as you're approaching the business, thinking what are your customers seeing as they approach, what are they experiencing and seeing as they walk around the business, in addition to what information are you putting out there about your commitment to these types of things. That seems to have an impact on a lot of people's minds right now. And again, I think that will shift as we get into the longer we go with the downward trend. I think people will ease up on that, but it seems to be heavy on people's minds right now. So I think it's really important to just exude what your commitment is, and that if you're going to have practices or policies of requiring employees to wear masks, which is now going to be one of the governor's guidelines starting June 8th, that most workers are going to be required to wear masks. The customer base is really going to be paying attention to that pretty closely.
And Dan, I think it is helpful and will be useful to dig into some of the demographics, because the demographics of who responded may not match exactly to the customer profiles for some folks. So they may be more interested in men only between certain ages, and I'll bet that does look a little different. So we just want to reiterate that we have we can do some of that, and this is just the overall from all of the responses.
And I think I will be able to do those demographic breakdowns, and what I'll probably do is just leave the same format, just have a gender version and then an age version, so you can see the breakdown by age on each of these different categories. So it'll be the same type of pie chart. It'll just be men on one side, women on the other side, so you can see that comparison to see if there's a difference for your specific type of business or the specific health and safety measures that we're talking about at the time. So moving on to, I think the overall trend is, you can see the blue pie slice is fairly large in all of these, but there are some variations. Like as you get into some of the more high congregation areas like movie theaters, the blue pie shrinks down. But when we look at churches and places of worship, and I think this is, it's still at 52.3%. I think that kind of plays into, how people personally feel about the importance of the activity, or the importance in their lives for that type of activity. So whereas a movie theater, you might have a lot more dense congregation of people. That might be a much lower priority, obviously, than churches or places of worship would be for a lot of folks. So hotels are listed at 44%, ready to start right away. I think, I don't know, Jennifer, if you recall from the WSU survey that went out, that was a national survey, that seemed to indicate that folks across the country were maybe less likely to be wanting to start in hotels right away. But it seems like we have still a sizable portion of people that are ready to start traveling too.
Yeah, I don't remember that right off the top of my head, Dan, but I do recall that Professor Garsoy, who did that work, that when we looked at it, what we were finding here pretty much matched that national study.
Okay. Yeah, so bars and nightclubs, which I believe are, Jennifer, if you could maybe answer this, where do they fit within the phased opening? Is that phase 3 or phase 4? Art's saying 4. That's what I thought. So even if Whitman County is able to move into phase 3 here, bars and nightclubs, if they're not food establishments, would still be not open until phase 4. Sports venues, I know a lot of people in Pullman and the alumni are interested in sports venues, and that's still that's still an open question of what is that going to look like for WSU football in the fall. Is it going to be possible, or what kind of changes are going to be required there? But there is some confidence. It's not as high as some of the other categories though. Parks, open air venues, I think like parks are much more confidence there. Pullman Transit and Dial-A-Ride. We've been continuing to operate Pullman Transit and Dial-A-Ride at significantly reduced capacity, and there haven't been a whole lot of ridership. But they've done a pretty good job over there of making sure that there's sanitation protocol, hand sanitizers available for folks, that folks are sitting far apart on the bus, and implementing those types of protocols, which I think people have by and large indicated that they want to see that type of protocol continue.
Can I clarify, Dan, just for a second?
Sure, Art.
Under phase 3, bars can open at less than 25% of capacity. I don't even know if that's viable for a bar, but nightclubs, concerts, larger sporting events, unrestricted other stuff is all phase 4.
Mm-hmm.
Okay, thank you, Art. Pullman Aquatic Center and Rainy Pool. I think as we get into summer, this is going to be a fairly important activity for a lot of families if they want to get outside the house in the heat. And I know that there are some specific restrictions or guidelines from the state coming in on all of these types of industries or specific venues. So I think one of the goals of this survey is really to indicate where consumer confidence is in these things, even though a lot of these things are going to be kind of dictated to us by the state government of what safety protocols are in place. This is just a good indicator of how are people going to react to that, because I don't think our customer base is necessarily going to know all of the ins and outs of the state guidelines, since they're so specific and there's so many of them that are so narrowly tailored to each specific venue or industry. It's going to be impossible for the general public to know what all those guidelines are for each specific venue. So this is more of an indicator of kind of their general feelings on these types of businesses.
Hey, Dan, I did pull up Professor Garsoy's study, and regarding traveling to a destination and staying at a hotel in mid-June or July, assuming that stay-at-home orders are lifted by then, they found that 7% was very likely, 19% likely, and then very unlikely was 36%.
All right, thanks. Yeah, and we were at 44% of folks saying that they might be ready to do that now.
Yeah, and within a month it moved to about 32% would be willing to travel within 1 to 2 months.
All right. And I know Joanna's on the line, so libraries, museums, cultural centers. When we started the survey, and I could look back and try to figure out when we changed. We did change this question at Joanna's suggestion. So we wanted to make sure that we did capture this separate from education institutions. So once we did, this is the breakdown of people that answered the question. So I don't know how many responses total there were for this specific question, but you can see here, it seems like there's a sizable portion of the population that does want to get back to using the library in a much greater capacity since we've been shut down. And then finally get to healthcare services. I know I am. I've gone in for a couple of tests and appointments, and I'm ready to get back to the chiropractor as soon as I can. I had a chiropractor appointment right before the shutdown, and I haven't had any follow-up since, and it's really starting to show. So, and and that's such an important thing. I think, I don't know if anybody is on from the hospital, but with the kind of, I know the financial situation of the hospital with kind of a lot of the elective procedures and things that people weren't going to for the past couple of months. The economic outlook there is pretty harsh. So, and you know, consumer confidence there, I think a lot of people are feeling confident in the hospital's ability to maintain safe protocol for sanitation, safe protocol for distancing and masks and things. And so I'm excited to see that 80% of the population is ready to go back to that now. Because I think it's really necessary that we keep money flowing in there wherever we can. But I still think there is going to be, you know, a certain percentage of the population that's just going to be hesitant on things for a while.
Just step in there. We do know from other kinds of retail trends that health and wellness is probably one of the things that's going to stick. So, you know, people really turning their focus and turning their attention to wellness and health. And of course, these numbers certainly conform to that idea.
And then finally getting down to personal services, hair, nail, and beauty, 56% right away, another 21% within the month. And then I added manufacturing and industrial services there. We didn't, the response rate on that particular question is pretty low, but I wanted to make sure that if there was some interest in from some of our manufacturing sector, like Schweitzer or Meter Group or some of our other manufacturing businesses, that we had something on there, even though I think a lot of those businesses are most of their customer base is business to business and done over the phone or over the internet anyways. Not a lot of walk-in necessarily customers there, but I think it's important to make sure that we capture that in case there is some interest in seeing more breakdown for that. And so that's kind of wrap up of this section. Do we have any questions or kind of feedback on any of the industry specific parts of the responses?
I'd be interested in hearing individuals' feedback, especially if you have already begun to open your business, and just to understand if what you're seeing here matches with what you have been experiencing. And again, anyone who is has a question or has a comment, if you'll just unmute yourself. And I see Tom Handy.
Yeah, hi, good morning, everybody. What we've noticed in our businesses, both in the restaurant, but to a larger degree in the tap room, is that it seems like most of the customers do not wear masks. Now, we do have a large part of our venue at the tap room that's outdoors, and that might have a part to play in it, but very few, I would say maybe 10% come in with masks. We don't require it. We obviously wear them when we're working, as an example of, you know, what we would like to see, but we don't. And even in the restaurant, there are very few people that walk in with masks. So it's kind of interesting, and it doesn't exactly follow the data that you've collected from the people that responded to this.
Yeah, I think there's some good points. Also, when people are drinking and eating, obviously they're not going to be wearing the mask the entire time. So I think, you know, that could play into it. But also I think folks that, you know, are even though there may be that kind of minority viewpoint from the respondents of this survey, those are probably much more likely the customers that have been ready to get out there right away, and they're probably less likely to feel the need to wear a mask. As we continue to open up, I think, especially after, you know, the issue of wearing masks is kind of constantly evolving in social media, how the news media is talking about the need to wear masks. The guidelines from the CDC, obviously, and a lot of health experts, is for folks to be wearing masks when you can't social distance. But it's really, the mask issue is it's a mitigation strategy. It's not a solution in and of itself. It's
right.
in conjunction with social distancing, in conjunction with washing your hands. It's one of those things that has the potential to reduce the likelihood of transmission. But it's certainly, you know, masks alone are not going to stop transmission of COVID. So it's one of those things that I think it's constantly going to be evolving, and I think that's going to be one of the issues that people have been focusing on in talking about whether or not masks are helpful or whether or not masks are necessary. But one of the takeaways I get from this survey data is that folks, a majority of folks, do assign some confidence level to seeing other people wearing masks. And so even when people don't feel that it's necessary, they don't necessarily agree that it's helpful to wear a mask, I think for those folks, it's important for them to understand that that may be true for you, but if it's impacting how other people's confidence is in entering businesses, that if I choose not to wear a mask, that could deter other people from re-entering the economy. And that has an overall negative effect on our ability to get businesses going again. And I think that's important to keep in mind in how we as a business community, as governmental agencies and nonprofits continue to message and communicate on that issue, is that whatever your personal thoughts or views are on masks and on some of these health and safety measures, the overall kind of impact on people that do feel that those things are important is important to keep in mind, because it's going to have an overall impact on how we recover from this.
One thing, just to put one more thing out there, one thing that kind of surprised me a little bit, I guess, is the number of people that are putting their names down on the voluntary contact tracing sheets that we put out. I kind of didn't expect to see as many people do it as are doing it. So that's kind of nice too.
That's interesting.
Yeah, and in the next section, we'll get into some of that. Not exactly on point there, but we will see something. Is there anybody else that has a talking point or discussion you want to bring up?
Or anything that you've noticed in your own business?
I'll briefly say this. I talked with the hotel in Colfax the other day with Mr. Cox that runs it. And he said that they're more at about 50% capacity recently. They were down as low as 15% earlier on. So some of that's changed, but I think your numbers bear up that they're not going to get loaded with people anytime soon.
Yeah, I know I've gone and sat on the patio at Rico's and at Mary Sellers and poked my head into the new Harbor Freight store, and they are nowhere near as busy as they would have been last year at this time. So that's a reality we have right now. And I think we need to have a concerted effort in improving kind of customer confidence to see those things change around. Because as even when we have kind of the downward trend and the low numbers that we have here, people just get inundated with the national media and the situation in Seattle and Yakima, and the fear is right at the top. And if we're going to be taking a strategy of shaping things at the local level and monitoring things very closely for health and safety with contact tracing, the consumer confidence is kind of a fragile subject for a lot of people, because it's dealing with your own personal health and safety and the safety of your family. So those are things where anything we can do to boost that consumer confidence as a whole is going to improve everything for our entire community. So let's move on to the specific health and safety options. So I could only fit 2 charts on each slide. So I'll just spend a little bit of time leaving these up here so you can kind of see here. Oddly enough, people are much more comfortable with businesses requiring their employees to engage in some of these things than requiring their customers to. So you will see a change as we get into, well, as long as it's somebody else that has to do it, I'm fine with it. But you can see employees wearing gloves. That was kind of a little bit of a question clearly on the side of people are comfortable seeing employees wearing gloves or being required to wear gloves. I think what you're seeing there is people not sure. It depends on the type of business, the type of activity that you're doing, whether or not employees are wearing gloves but not changing them frequently. Are you just having a bunch of stuff get on the glove and then having that be transferred to customers? So there's a question there that I think is more nuanced on the type of activity. and how frequently employees are washing their hands or changing gloves. As we get to employees wearing masks, I think the clear indication is that most people want to see employees wearing masks. And again, with the governor's guidelines that will go into effect on June 8th, this is going to be a requirement for most workers anyways. As we move on to temperature checks for employees, this one, I think you'll see a clear disparity between what's required of employees and what's required of customers. And I put both those questions on there, even though I kind of had an inkling of what the response was going to be. People are okay with temperature checks for employees, but when we get to the customer requirement for temperature checks, I think you can start to see that there's a breakdown of what is the utility of it and what do consumers expect from businesses in terms of invasion of what they feel is their privacy or personal autonomy. So plexiglass barriers, again, that's a clear trend. A lot of the comments included specific comments about plexiglass barriers where they make sense. So it's not about just putting up a bunch of plexiglass just to show that you're doing something. There is an indication that people want to see that at customer service portals, where you're walking up to a counter, having a barrier, but not necessarily barriers all over the place. Posted practices aimed at preventing spread of disease. So there were quite a few comments, individual narrative comments about this as well. Clearly people are indicating that they want to see what you are communicating about what you're doing with health and safety. So, a poster on the front door of the business, posters or signs saying, please wear masks, please wash your hands, those types of things, but also clear communications about what your protocols are for sanitation. And some of these things for specific businesses are required by the governor's guidelines. But a lot of people want to see these things posted to your website or to your Facebook so that they can make a determination before they even head out of their house, to know if I drive downtown and go into your shop, what are you going to be doing to ensure my safety? They want to be making some decisions before they even leave the house. So I think it's really important that you have these things clearly communicated in not only within the establishment, but on your website and your web presence. And also that you're clearly communicating that to your employees, and that customers have a sense of what your commitment is to actually following through on it. There were several comments about, don't just say you're going to do something. If you say you're going to do something, they really want to see that implemented in practice. And if they see those things not being implemented, there's I think a sizable portion of people that are willing to just say, I'm not going to come to your store for a good long while, I'm going to go somewhere else. If they feel that kind of, I think that what we're talking about here is a establishing of a trust relationship. And as soon as they start to see something where that trust relationship, they feel like it's broken, they're ready to move on to a different store or a different vendor if there is one available. So I think that is the communication about this, I think is one of the most important things that we need to keep in mind right now. Hand sanitizers for customers, that's clearly something people want to see. There's very little resistance to that, and that's one of the easiest things to do if you can get your hands on a lot of hand sanitizer. When we get to customers required to wear masks, you start to see kind of, there's less neutrality on this issue. There's the majority of folks that are on the, they want to see that happen, but then there is an increasing minority of folks that say that they're not comfortable with that. And there were a few, I won't say that there's a lot, but there were a few narrative comments that said, if they're asked to wear masks or if they're required to wear masks, they won't come back to that business. But I think that's the clear minority viewpoint. So that's going to be one of the things, and I think we've seen from situations around the country, this is one of those potential conflict areas with between businesses and customers. I think the more that there is a consensus among community leaders about communications about this, will support businesses that want to enact a requirement for customers to wear masks. if we can talk about the positive communal benefits of wearing masks, that will support those businesses. What I worry about is having businesses be in those kind of conflict situations that in some areas of the country have turned violent. I like to think that Pullman, most of our business owners have a rapport with their customers where they can talk through those issues. But I think that is potentially a worry that the business community and the customers may have is, if you want to require people to wear masks, how do you do that effectively? How do you talk to people who are resistant to that? And I think one of the ways you do that is like I said earlier, have a conversation, a calm conversation with them about, what we're seeing in this data and the desire from the majority of folks that want to see people wearing masks, and how that is going to impact their business, and how they have to implement. You might have to implement some of these things to ensure that you have enough customer base to make it through until we get back to a time when you can be at full capacity again.
How do you match that, Dan, with the issue of some people not being able to wear masks, or even some employees may be unable to wear it due to health issues or other things? There's some exceptions in that rule on employees wearing masks for that.
And I think that has to be, you have to take reasonable, there has to be common sense in how you approach this. And I think anywhere where you have specific information in the guidelines coming from the state that talks about exceptions to wearing masks, that should by necessity follow from, if you're making exceptions for employees, you would have to be making exceptions for your customers too. And if you identify some of those things that you think might be particularly impacting your business or your customer base, it'd be important to talk about what those exceptions are so people know what to expect. Because I think if you did have more people that that have a health condition that requires that they don't wear masks, I think communicating that to folks and letting them know that, hey, if you see people wearing masks, we have a general requirement that people wear masks. But if you can't wear a mask because of a health-related condition, just let us know and we'll work with you to make sure that you can still come in and utilize the business. I think that with all of this, there has to be that kind of common sense approach. But I think most of this is about how we're communicating that to the broader community too. So that we're trying to balance the needs and the confidence level of people on all ends of the spectrum. Here's where we get into where the questions kind of start to flip on where people start to get really uncomfortable with something. So when I put these questions in there to specifically get at some things that I knew there was going to be more people that were uncomfortable with, so we could actually see where is that kind of breaking point where people say, yeah, we want to see health and safety measures, but we don't want to go too far. So I think when we get to the customers asked, if you're wanting to ask customers about COVID symptoms, people get real touchy about sharing what they feel is their private medical information with somebody who doesn't necessarily have that kind of medical background. And also the same thing, I think, with temperature checks, where, how do you do a temperature check and maintain social distancing? And how do you have, there's all sorts of liability concerns that come to my mind as a lawyer for businesses who are going to be then, touching customers with a head swipe thermometer, and can you even get enough head swipe thermometers if everybody wanted to do this right now? So I think this is clearly showing that this is something that is on that more, people generally are in that kind of either, yeah, I'm totally fine with it, but it's more of a flat line instead of a clear indicator. People are all across the board on how they feel about these things.
Dan, I just want to let you know it's about 5 to noon.
Okay. So we're at the last one. Touch-free payment options. Everybody likes to see that. There was lots of narrative comments on how well Starbucks has implemented this, including people indicating that they should use Starbucks as a model for how to do touch-free payments. I haven't been through the Starbucks line personally, but I know there have been several of the drive-thrus that have implemented options where it's very low, low touch options. So I mentioned this a couple times, but the key takeaways I think are clear majority of consumers are ready to start entering businesses with safety precautions in place. And consumers want to see, they want it to be visible what safety precautions are being implemented, and that businesses are consistently applying the rules to everybody. So if you're going to have a requirement, make sure you're enforcing that requirement, and that you're communicating about it, posting your safety practices online on a poster in the business. And because a lot of this is really about how you are expressing your commitment to your customer safety. The last kind of section of the question was, I put this in here because I know there's been a lot of businesses that have been starting to change things, like starting to offer delivery services, and they haven't been charging for it. So I wanted to tap into kind of how the community feels about, if there is increased cost to the business for implementing some of these things, would you be willing to pay a little bit more for the service? And, you know, when I looked at the narrative responses on this, you know, 36.8% said yes. 34.3% said maybe, and that other percent, the narrative responses on that other question, the majority of those, I would say, were along the lines of, if the businesses increase their cost because of this, they'd be willing to pay a little bit more. But there is still kind of balancing that with wanting to make sure that, you know, it's clear that people don't want to see businesses profiting off of making a profit off of increasing health and safety measures, but they're willing to cover some of those costs. But they also balance that against the idea that so many people have lost their jobs, so much uncertainty in the economy right now, that they're willing to pay a little bit more, but maybe not a whole lot more. So that's just something to take into account. And then finally, I think the biggest message from this is that regardless of how individuals feel they are on the spectrum on any of these questions, the communication strategy that everybody needs to engage in is that this is something that is impacting all of us. It's our entire community. It's our entire connected community. And we need to have kind of clear communications that that increase consumer confidence as we move forward, with an eye on the fact that there is still a lot of unknown about how the pandemic is going to play out. Is there going to be a resurgence in the fall? How is that going to impact things with businesses reopening now? If we continue the trend, the downward trend, and we don't have a resurgence, that's what everybody's goal is. So how do we balance the, you know, making sure that stays the case, but also at the same time increasing consumers' confidence in being able to re-engage with the economy, so that those businesses, you know, will still be here in the fall. I think that's the ultimate takeaway, is that we have to implement some increased safety measures, and when folks feel that those aren't necessary, they need to understand that it is necessary to do that, to ensure that we have the economic recovery for those folks that do feel that it is necessary. So this is something that's going to take compromise on a lot of people's parts in order to get through this. And you know, we just have to make sure that we're communicating clearly, we're implementing health and safety procedures that people say they want, and that we're recognizing and pulling people into the fold of recognizing that by engaging in these measures, we're increasing the viability of businesses and our community from recovering from this as we move forward. And with that, we are at 12 o'clock. I'm able to stick around a few minutes longer if folks have questions.
Thanks so much, Dan. Folks, if you are interested in asking a question now, please go ahead. And I also want to invite folks to reach out to us afterwards if you have to take off. But I see that Paul Kimmel has his mic off.
Can you hear me?
Yes.
Yep.
Thank you. Well done, Dan and Jennifer. Really fabulous information, really insightful. Bravo. So thank you. Is it possible to get a copy of these slides?
So we are going to post the recording. I think Jen's been recording this and we'll post that soon. If you'd like a copy of the slides separately from that, I can certainly put something together for you.
Yeah, I think they'd be helpful in a lot of other communities. You know, the same questions are being asked. Granted, our demographics may be a little different, but I think, you know, as a general rule, really, I think they'd be really consistent and helpful for a lot of communities. So thank you.
So what I'll do is I'll turn it into a PDF and then we can post that along with the recording.
Tom also had his, is unmuted. Tom Handy?
Yeah, I've got one more question. Is there a way I could get some more of the drill down information into the pay extra for the PPE data that you've got? I mean, we're considering that partially because it is quite an increase in cost, you know, buying all that hand sanitizer at inflated prices. And in our restaurant, we change gloves in between every table that the servers go to, and gloves aren't too cheap either. You know, and so there are added costs that we are incurring because of this. So,
Sure.
Yeah, I will take a look at that for a drill down breakout.
okay, thanks.
Thanks. And Joanna Bailey.
Yes, thank you. I just wanted to say a huge thanks to Dan and Jennifer for being willing to include the question about the libraries. It's been really helpful to see how the community is feeling about, you know, as Pullman reopens, and also specifically with the library, what the sentiments are around the library. I know we couldn't capture everybody, but I appreciate having that question being added as early as it was in the survey. So thanks very much.
Yeah, and I will let you know, Joanna, what the specific response rate was for that. We did it fairly early, so it was pretty high. It wasn't going to be 2,400, but I know it was pretty high still, anyways.
Terrific, thank you. And if there are any comments or narrative about the library, if you could share those out, that would be great.
All right, sure.
Thank you.
And just so everyone knows, there were only a couple of businesses that people mentioned specifically in the comments, and I will be reaching out to those business owners to talk about any specific comments that we received in the poll. But that was just a couple of businesses.
Okay, Marie.
Yeah, well, first of all, thank you for doing this survey. I think the information is really helpful. I agree with Paul that it'd be nice to share this with some of our smaller communities in the region and the businesses that are trying to open and convey the same sort of messages that we're trying to do here. And then also, I was going to ask the same thing that Tom did about drilling into what those extra expenses look like and how much that, you know, how much that is adding to some of the business expenses, like you mentioned, the delivery services that have been free. How long are they going to be able to keep that up? You know, that's just been for cash flow, but as we reopen, you know, how are they going to be able to continue that? And then a statement, using masks, gloves, etc. I think are great, but let me just tell you, I've been to a couple places now that they're using gloves, and gloves are supposed to be disposable for a reason. So if you've handled a bunch of money from the customer before you with those gloves on, it's just like wearing no gloves and handing the cash back to the next person. Gloves need to be changed frequently if you're going to use it in that way. Just a state.
That was my point of, you know, for specific tasks, it might be one thing, but consumers, I think, are, and I think that's indicated in a little bit of the data, is that, and some of the specific narrative responses too was, you know, concerns about gloves. The appropriate protocol for gloves has to go along with it. It's more context than just saying wear gloves. It's wear gloves appropriately, change them appropriately, and don't wear gloves and wash your hands appropriately for the specific tasks that necessitate that. And thanks again, Marie, for the Chamber's help in getting the survey distributed.
Actually,
You're welcome.
We should certainly say thanks to the Chamber. Thanks to, I think Pullman Radio also mentioned it a few times, and to all the other outlets that helped us spread the word. Okay, are Are there any other questions or comments?
I've got one real quick, hopefully, Dan. What do you think the impact of the students coming back would be on some of these numbers in terms of things they'd expect or things they wouldn't pay attention to or weren't important to them?
I'm not sure we can really draw much conclusion from this survey, because without being able to pinpoint kind of we have the age demographic in there. When we see the age demographic breakout, we might be able to talk about that a little bit more. But we also don't know if that's because we don't have a clear way with this data to look at WSU student versus non-student. But I think that age might be an indicator that we could correlate to that as well. So that'll be something we look for in that age breakout. But I also think, you know, if you think about the WSU student population, there's a lot of factors that go into that. So if we have a lot of students that have gone back home to stay with their parents during this time, if a lot of them are around the Seattle area or in those kind of high impact areas, they might have drastically different viewpoints than people who have been in our area with not that level of impact by COVID. So that could play into it as well.
Okay. I want to say thanks for this info too, because we're looking at how we open up the courthouse and interact with people, and this data will be helpful. So thank you.
Yeah.
All right, I think that likely concludes the webinar. I want to thank everyone for taking the time to join us today and to get this information. Again, this will be available as a playback on the city's YouTube channel, and we will be providing the slides. And I encourage anyone interested in digging more into this data to reach out to either Dan or myself, and we'll be happy to kind of walk you through it. So really good kind of ahas coming from this initial survey. I noted that, you know, outdoor space seems to be the way to go. People are really comfortable being outdoors. It looks like the hands-free solutions are a low-hanging fruit if you can do that, and also really engaging in communication in as many ways as possible, online and in person is what, you know, what I'm hearing also. So those are really, really great feedback. Thanks so much, Dan, for putting this together and getting this out there and getting the information.
And thank you, Jennifer, for all your help along the way.
All right, everyone. Well, we will be posting this out, and if you have any other feedback for us, please let us know. Thanks so much.